Everyone, welcome to this episode. Shaun, Brewster, and Bodine and Ledden. Bo, today we're going to be talking about expectations in clinical practice. Now, expectations is one of those things that can either leave a patient very satisfied or very dissatisfied when they come out the other side of a consultation. What are we going to talk about
Yeah,
here?
yeah, it's one of those things that we really do need to set, and it's often one of those things that we tend to make assumptions about what the patient wants when they come in for a treatment. So really diving into what are they actually expecting from us in the short term and the long term, and not only, when we look at that within the session, what are they expecting as far as education, hands-on, exercise, mobility, the treatment plan going forward. How long is this going to take? All of this sort of stuff, I think, really needs to be established from the start.
Yeah, you're right. And it's the same in life, right? If we go into any situation where we're expecting one thing and we get another thing, we'll often walk out going, well, that's not really what I was after. If you walk in there with a little bit of a setup, you walk into a room and someone says to you, when you walk in here, here's what's going to happen when you walk through the door. Regardless of what you're expecting before that, you can kind of readjust, recalibrate. And I think that's a really good thing that we can do for our patients is when they come in the door, set the expectations from our side, and like you're saying, also get a sense of what they're looking for. And then maybe we can meet somewhere in the middle. So we can do what we need to do to help them, and they can get from the experience what they feel they need to get to the next step.
Yeah, exactly. When we think about that as well, like when people let's call it non-compliant with exercise or non-compliant with their treatment plan, well, was that our fault for not asking their expectations and us not delivering our expectations to the patient? So when we look at that, is a patient coming in just for that short-term relief? Do they want an entire hands-on passive treatment? Are they expecting to receive some exercise? Are they expecting to receive some education about what's going on and a prognosis? Are they expecting to have this resolved within 2 sessions, or is that unrealistic? So we need to really set those expectations and say, hey, how long do you think this is going to take? And we can say, well, realistically, we're looking at a minimum of a 12-week period, or it could be a 6-month period or a 12-month period for changes in these symptoms. And this is going to require a little bit from both parts. I expect some feedback from you along the way as far as the things that are working, things that are not working, things that you would like to improve or progress a little bit faster, things that you're enjoying and things that you're not enjoying, and other things that may be going on in your life that are affecting your progression with treatment. So I expect this open communication from you so that we can move forward collaboratively together to get the best results for you.
100%. Yeah. And I think it could be quite easy, if someone listened to this today and went, okay, yeah, I need to be a bit more realistic in my timeline, and it's probably going to take longer than they want it to, and it's probably going to take longer than I'd like to tell them it's going to take. But I think we can also look at that in a different way and say there's different scales of effect in treatment. So if somebody comes in and they've got disc-related pain in their back, or they've got a hamstring strain or something fairly mechanical, maybe, it's highly likely that what we're going to do in the treatment will resolve a high percentage of their discomfort quite quickly. And so we might say to them, yes, it's going to be 3 months, 6 months, whatever it is. But we can say, I believe that based on what you're presenting with here, we can get your symptoms very much under control. We can reduce a lot of the discomfort you've got going on fairly quickly. So there'll be this tapering off of your discomfort. This is what you should expect: 1 to 2 to 3 sessions, a massive reduction in discomfort, providing we are on the right track here. And then there's going to be a longer tail effect with the recovery. That's where your exercise is going to come in. That's where the education is important. That's where your understanding, your preventative type stuff is going to come in, so that it doesn't return. And so it's not just about saying, oh, it's 3 months, it's 6 months, or whatever we expect it to be. It's here's the progression of your symptoms. Because what does the patient care most about? They care about their pain, their discomfort, and they want to know, can you help solve the pain? Yep. We can help reduce your pain very quickly. But if you want a solution, a resolution of your problem, that's where we need to look at these longer time frames and what you can do and what we can do as a team over that period of time.
Yeah, and within that time frame, that's not just a linear thing as well. I had a patient last week and I said, look, this is going to be a minimum 12-week intervention that will include some manual therapy, but ideally we're moving you more towards active interventions with exercise. She said, great. And I said, okay, so let's look at your next session. And she's like, okay, I'll probably come in every second week. And I said, well, that's probably not the best way forward. What if we looked at doing a more frequent dose of treatment earlier on? So getting you back next week and the following week so that we can see how things are responding. Ideally, we're looking to get the symptoms reduced, or your discomfort and level of pain reduced initially, so that then we can start to space these sessions out where you can take over and you can self-manage. And it may not be that you need to come in every second week. It may be that you then need to come in every 3 weeks, 4 weeks, 6 weeks, or whenever you need it, because it shouldn't be that there's that consistency, that they're having the expectation that they will still have symptoms, progressively over this period of time. So it's looking at that time frame, but the frequency of treatment can certainly change within that time frame. And when we look at how long things take to heal, for example, you mentioned back injury before. Well, there may be resolution of 50% of people will resolve within 12 months, regardless of intervention. So we might even say, well, look, it could be up to 12 months. All right. But that does not mean that we need to see you every single week for 12 months. But just be mindful that we're probably not going to have the resolution of symptoms immediately. These symptoms can hang around that little bit longer, but in that time frame, what we're looking for is changes in your function, improvements in quality of life, decreased levels of irritability and sensitivity, all of these things that go with it. So I think that's really important to frame that up. Otherwise, a patient can get quite frustrated, 3-4 months down the track, and they go, I've still got a bit of pain. Maybe they're not the best practitioner. Maybe I need to go and see someone else. Well, we've got to understand natural course of healing as well.
That's right. Yeah. And you used the word frame there. And I think that's really important, because if we say to somebody, this is likely to take us 3 months, 6 months, 9 months, whatever it might be, the first thing that their brain will jump to is, you mean I've got to pay that, whatever I'm paying you for every consultation, every week or every fortnight for that entire time? And no, shouldn't be. And we did a podcast quite a while ago about this idea of over-servicing. And the classic example of that is the practitioner says, all right, this is going to take 3 months, 6 months, and I'm going to need to see you every week until it's resolved. How could you possibly know that you'll need to see them every week? If you think you need to see them every week, all you're doing is sweeping their symptoms under the rug every 7 days. That's really all you could be doing, because at a certain point, as part of that natural course of healing that you're talking about, the human body should improve its functionality, should improve its strength and its robustness to a point where it doesn't need us anymore. All we're doing is helping guide them in the right direction. And I don't think in any reality we should be required to see a patient every week until they are better. It should be spaced out.
Yeah, 100%. And I think that's the importance of setting goals with the patient as well. So even though it could be a 12-month time frame, well, we need to find out, well, what are you hoping to achieve from this? What do you want to get back to doing? What do you really value, and what do you enjoy? Let's set some realistic goals to help to get you there. These shorter term goals. This could be, all right, well, in 6 weeks, I want to be back to walking 5Ks. I want to be back to being able to work a full day with less discomfort and less symptoms. Because it's not always, I think we tend to assume that the patient wants complete resolution of symptoms. Sometimes that's just not realistic. What do you really want out of this? Is it the complete resolution of symptoms, or what's an acceptable level of symptoms that you could manage? Because you know, in some cases that people just want their life back. They just want that quality of life. They want to be able to go and do the things that they enjoy, and they can manage a bit of symptoms. That's fine. You know, I think it is really unrealistic in a lot of cases to have the complete resolution, because that can also be perceived then as you've failed them, or the patient may perceive that as you know, my clinician has failed me because they haven't been able to take away my symptoms. And you know, when we look at self-efficacy and all of that sort of stuff and shifting the blame, you know, that's a interesting topic as well. But you know, I think really setting that as those expectations and asking them what would be an acceptable level of symptoms and what do you want to get back to? Great. Let's set some goals for you. You know, and that's that shared decision making, so that we're both accountable. You know, the patient's more accountable, but we're there to essentially coach them along that journey. We're not there to take away their problems and heal them. We coach them. We reduce their symptoms. We provide them with some education about some contributing factors and how we might be able to assist them in modifying that over a long term. So this is more of that support over their journey, essentially. So yeah, I think thinking about it from that way can be quite important.
Yeah, and giving people a bit of hope too, right? And you could, like you're saying, what's an acceptable level of discomfort for you now? If you want to be able to get back to going for a walk with your granddaughter every Thursday afternoon, like you were doing before this knee pain started, you know, as an example. Okay, I'd like to be able to do that walk with my granddaughter every Thursday. Great. Could you do it with a little bit of discomfort? Yes. Okay, well, let's set some realistic timeframes around getting you to the point where you can be functional again. Now, functional doesn't necessarily mean pain-free, but it's functional. You can do the activity you want to do. And so I think, based on natural course of healing, based on manual therapy intervention, exercise, other things that you might be doing, we could probably get you walking comfortably in 3 weeks, 5 weeks, whatever it might be. And so there's some certainty. There's some certainty. This idea of certainty, I think, is a really important one. It's one of the basic human needs. We all need some certainty in our life. We like financial certainty. We like the certainty that we've got some food to eat. We like the certainty that we're going to have a job to go to tomorrow. These are things in our life. We all crave that. And I think as a patient coming to see a health practitioner, they come in with a problem that needs a solution, and getting a solution gives them a degree of certainty. Now, it might not be the solution on that day, but it's the projection towards a solution. I was talking to someone just a few days ago about a diagnosis that they'd received, and from a health practitioner. And the diagnosis that they'd received was not a positive one. You know, they were diagnosed with something that was going to mean that they were going to probably be put on fairly serious medication, probably for the rest of their life. And I won't go into what it is exactly, but it's a diagnosis that's probably over prescribed. And then there's options. There are other options for it. But this person, even though they'd received a fairly negative, fairly life-impacting diagnosis, had this degree of relief. It's like, at least I know what it is now and I can do something about it. You know, in my mind, I'm thinking, yeah, but those drugs you're going to be on are going to cause a whole raft of other problems. And then there's alternatives to that. But this degree of certainty that the person got from the diagnosis, from a name against a problem that they didn't previously understand, there's power in that, right? And we've got to be careful, because as health practitioners, the second we put a name on something, that's what it is. You know, it's very difficult to change somebody's mind. And so there's 2 parts to this. One is we want to give them some certainty. We want to give them some, yes, I believe I know what your issue is, and I believe I know a way towards a solution. And the other part of this is, yes, I know what the problem is. Here's a name that's Googleable. The second that they can go and Google that, or ask somebody who's had that thing and get their story, they then start to create their own story, their own future projections about what that means for them, which may or may not be true. And so giving the person a projection, a prognosis about the expected progression of this condition is super important. We also have to, at the same time, give them a degree of education that doesn't let their imagination or their perception of that thing run off in an unhelpful direction. That's where we end up with these overlays on top of chronic pain presentations that aren't anything to do with the pathology. They're to do with the psychology of the person.
Yeah. And I think framing it up, you know, I said the time frames before 12 weeks, 6 months, you can also give that as a window. This could take between 12 months and 2 years, or it could take between 6 weeks and 6 months. And there are certain things that can influence that. And that could be lifestyle factors, nutrition, your coping mechanisms, your thoughts, your beliefs, your behaviors, your social support network, all of these things. So pain is complex and there are various different factors that can influence that. Are you open to discussing some of these other contributors that may be affecting your pain, such as your level of stress? And are you open to some strategies that we could look at for some stress management? So that again can be an expectation that's where it's not just a mechanical thing. I think if someone comes in and they're expecting you to fix their problem or fix their diagnosis, well, that's probably, the expectations are going to be a little bit off there, because that's not necessarily what our job is. We don't fix things. We educate people, and we can reduce their symptoms in the short term to hopefully educate them about changing behaviors and looking at other influences to then promote long-term change. So, when we look at the complexity of pain, again, it's not just a mechanical thing. There's biological factors, psychological factors, and social factors that can influence a patient's pain experience. So I think asking our patient, are you open to looking at some of these things that may be influencing your pain experience? And, if that's not something that you can manage, it could be some of their coping mechanisms could be, drinking. It could be binging on food. It could be, watching TV, not doing a whole lot of exercise or activity. Well, that's when you can, ask them again, are you open to consulting with a multimodal team, and we can engage other practitioners to help you along this journey so that we can move forward over time. I think when we do these could be recommendations, but asking the patient about it, are you open to this? Could we go through this? What are you expecting from me? And what would you expect from other practitioners that you may be seeing as well? You see this all the time too, where, I see my chiro for my back, and I see you for my hip, and I see an osteo for my abdominal issues and whatever. And then you think, all right, well, what are you expecting from each of those practitioners? Are we all working towards the same common goal here? Or is everyone providing slightly different views and opinions and advice and language around what's going on? So yeah, really sort of challenging patients' ideas and beliefs and seeing if we can all get on the same page, because, seeing all different practitioners for the same thing may not be helpful, but it also may be helpful if we're all on the same page together. So it's a tricky one.
It is. And the whole idea of seeing different practitioners, often it's a case of, you'll go and see your such and such therapist because they are a practitioner that will tell you that, let's just rub that sore spot out for you. And that imprints on your mind that this is going to be a quick fix. I've got a sore back. I can go in there. I can see my massage therapist, whoever, and they can massage that sore spot and it'll settle it down. And the language they'll use to describe what they do will lead you to believe that you can have a short-term solution, short-term outcomes, and then that's great. Perfect. We move on with life. Whereas you might go and see another practitioner and they'll see the same problem, have a different perspective, and they go, well, that's the underlying symptom of this other problem, this weakness you have over here, or this whatever it might be. And so that's going to require some exercise. You go, well, I won't see that person because I want a short-term solution. We only see the things we're looking for, right? Mm. And so it can be very easy to kind of cherry pick practitioners based on their style and their approach, and then that will then guide us to go, well, when I've got this kind of problem, I'll see that person, and when I've got this, I'll go and see it's someone else. But I think as health practitioners, it's incumbent upon us to be able to say, well, hang on a second, regardless of what this person is wanting from me, what do I know to be true? What do I believe to be true? We don't know anything, but what do I believe to be true about this person's presentation? If we dive down through the layers of this and the different levels of it, if I'm doing what you're saying here, Bo, and saying, okay, well, let's actually pull it all apart, your expectations, my expectations, let's see if we can discuss it and meet in the middle, I think we'd have less of this shopping for practitioners. We'd have more of a case of, okay, I'm going to go and see my health practitioner, regardless of what they are, and they will have my best outcomes, best interests in mind. And the approach that we should all then take is use all the skills, all the knowledge we've got to give that person the most well-rounded and truthful outcome or experience we can. And there should be less of this, I'll just rub it out. You need to do this exercise for the next 10 weeks and have 55 sessions with me. Like, there would be less of that variation if we all come at from this perspective of, let's actually help the person with their problem.
Yeah, definitely. And if we give people this really simple, easy solution, well, it's a mechanical problem, we'll press on it and we'll make it better. Well, that may not be correct. We can use that to modify symptoms, but people often are looking for that quick fix, that short-term solution. Like a classic example is corticosteroid injections for rotator cuff related shoulder pain or hip pain. These things can take a long time and they require progressive management, progressive exercise, changes in behavior, all of these things that can influence chronic type conditions or persistent pain. And so if someone is expecting to have an injection that will resolve their symptoms, well, I mean, if it is purely a mechanical issue, then maybe. But that's often not the case. So we've got to think about that. Well, if someone is just looking for that quick fix or that practitioner that can take away their symptoms and not provide them with that honest truth that, well, this can be a long-term thing. Are you willing to commit to consistent sessions and consistent self-management and over a longer period of time, because if they're not on board with that, well, it's sort of I guess a verbal contractual agreement, that you're coming to see me because you want a solution, but for us to get a solution together, I'm going to need some things from you as well, and I need this agreement that we're both going to have this shared decision making to collaboratively come up with a plan. But for this plan to work, it needs to be in place over a longer period of time, because it's probably unlikely that we're going to see some significant changes short term. We might have some reduction in pain, but to see the changes in pain in the long term and improvements in function and quality of life, this will more likely take a lot longer than this short-term intervention. So are you on board with going forward over 6 months, 12 months and having that back and forth communication?
Yeah, and that's going to be definitely true for your chronic pain presentations, these longer standing things. But the opposite, I think, is also true for some of the very acute short-term stuff. If somebody steps off a gutter and causes a very minor, irritation at a facet joint, and then they get some spasm, it could just be a case of, let's go and push on that joint, create a bit more mobility, reduce your symptoms, and it's one session and you're a miracle worker. That stuff still happens. I think that's still true. And if your client population, your patient population is more of that acute onset, maybe even sporting type injury sort of presentations, then a lot of the time the solution might be one session, 2 or 3 sessions, a bit of exercise and some at-home care. But if we're talking the chronic pain stuff, like I think what you're pointing out here, none of that gets resolved long term. They'll say, oh no, I go and see my chiropractor, I go and see my physio, I see my acupuncturist, whoever. They give me one session and I'm good. And you go, so if they fix it, well, it's good for a month or so. Okay. So what they've done is modified your symptoms for a period of time. In that period of time, you've moved more, felt good, and then life has happened and it's come back again. So it's sweeping it under the rug. Yeah. So let's look at solution that will actually change your body to a point where you no longer have those experiences, those recurrences don't happen. And it's going to be about you doing some of this stuff with me guiding you along the way. If you're open to that, are you open to that? And then where we're going.
Yeah, that's a good point too. And, like we could look at it from that point of view where you've got let's say you've got an invergent ankle injury, right? Someone comes in, they've sprained their ankle, grade 2 tear to their ATFL, let's say. And we think, all right, well, let's look at 6 to 8 weeks. And in setting those expectations in that time, if we've got a time frame, 6 to 8 weeks of progressive exercise and then return to play, well, that's obviously setting that expectation of how long it will take. There's some things that can influence that. How consistent you are with the exercise. There can be also other factors, socially and psychologically, in particular, when we look at athletes, the psychological factors are often missed or overlooked. But that can influence pain intensity and longevity as well. But, setting those expectations of, all right, this is how we're going to manage it in the first 2 weeks. We've got to address the inflammatory component, and then we've got to start getting you loading, and then we start to progress that in the from week 2 to week 4, and then from week 4 to week 6, and then 6 to 8. So there's always going to be progressions along the way. So that's no different to your chronic pain cases, but it's just going to be stretched out over a longer time period. It's the same sort of thing. We still address them in a similar way, but obviously, when you look at those acute injuries, you're going to have the natural course of healing, and that we can be a little bit more predictable around that. And there again can be factors that can influence that. But framing that up is a great example of this is how it's going to go. This is the sort of approach that we're going to take. You've got to be mindful of things that can influence that. And in fact, I think a good example, I gave a presentation to some athletes a while ago, and I said, well, if you want to win a grand final, then you train like you're going to win a grand final. If you want to win a marathon or complete a marathon, then you train like you're going to complete a marathon or win a marathon. If you want to rehab and get back to play within 6 to 8 weeks, then you're going to rehab like someone who wants to return to play in 6 to 8 weeks, like an elite level athlete, right? So you're going to do all of the things in that time period to make sure that you return to play optimally. And what are those things? Well, the tissue heals, but what can influence that is how much sleep you're getting, the amount, the appropriate nutrition that you're putting into your body, the strength exercises that you do, the mobility, your social support network, your mood, all of that influence how your body will respond and adapt. Okay. So again, that's no different to your chronic pain presentation, where if they're not putting in optimal nutrition, if they're not loading their body appropriately, if they're not sleeping appropriately, if they've got high levels of stress, anxiety, and other mood-related disorders, well, that will all influence their body's ability to recover and repair. Okay, so all of those factors can be so important in anyone and everyone's recovery from pain and their general quality of life.
Yeah, and that comes back to our key point here, right? Expectations. So if a patient comes in and they're frustrated with their ankle, hasn't healed fast enough, if they're frustrated that it's taken an extra 2 weeks longer than they expected, and their coach is on their back to get back into the game, and it's getting towards final season and they're not ready yet, these are all poorly framed up expectations. Either an expectation that they've created in their own mind along the way, assuming that things are going to go like they have in the past, or like their friend happened, or whatever it was, or the practitioner, the health practitioner that's been in charge of or responsible for educating them hasn't done a great job, aka us. How have we not advised them appropriately or set the expectations appropriately so that they can go, you know what, it's going to take somewhere between 6 weeks and 10 weeks, and we don't really know. What are the things I can do, the athlete, what are the things I can do to make sure I can make it 6 weeks and not 9 or 10? And what are the things that could make it 9 or 10 that I could maybe avoid? What not to do, I'll stay away from. And these are all about this framework, this expectations.
Yeah, that's a great point. We've got to frame that up, and it's great if our patient does ask those questions, but in a lot of cases, particularly with persistent pain, people have just accepted that this is the way that it is, and they're going to have to put up with it. And like you said, they can be frustrated. That can lead to anger and all sorts of different emotional factors that can, again, influence and amplify pain experience. So I think, being, I guess, being very upfront and honest with our approaches and what we want from the patient, what they want from us, because if they are just expecting us to do a passive treatment for 60 minutes and expect to have some good long-term changes, well, that may not be the best thing. That may be great for modifying their symptoms and decreasing their pain in the short term, but that's probably not going to address the behavioral factors, lifestyle, psychological, all of these other things that can contribute to their pain experience, the levels of stress, all of that. So yeah, I think we can frame that up when we consult with a patient to say, okay, well, I'd like to go through some education about what's potentially contributing to your pain experience. We can do a little bit of manual therapy. And then we may look to do some mobility, some strength exercises. These are things that you can start to do more and more at home. Is this something that you would be on board with, or is this something that sounds appropriate for you? And then, if they agree, if not, then we can say, what would you expect, or what would you change in this treatment if you could give me some feedback on the treatment, how it went, and how you would like to see it progress over time. So we can really understand what they actually want from us. It's not just about us telling them how it's going to go, because they want to have some input as well, because it is them, after all, that we're dealing with. It's their body, it's their life. So that's that sort of shared communication and feedback from them, so we can improve our compliance and hopefully get better outcomes.
Yeah, for sure. I've put together a bit of a process that I'd love to get your opinion on here about how we can best make sure that we are hitting these targets around expectations and education. So it's like a 4-step process. The first part is, and we'll use your scenario of the person with an inversion sprain of an ankle. They come in, they're presented at whatever period as part of their recovery. The first thing we should do is educate them, help them better understand what an inversion sprain is. So actually break it down to the pathophysiology. Okay, there's this ligament right here. You've overloaded that ligament. This is a result. This is why you got the swelling. This is why you got the pain. Help them really understand the thing that they've got. Remove any mystery, remove any preconceived ideas. Here's the actual thing that's happened to you. No fear. It's just what it is. So that educates the first bit. The second step is personalize. Okay, why is it that you've got this particular injury? We can talk about tissue capacity. We can talk about gradients in loading of tissue, like how you've exercised more than you normally have, or you've changed surfaces, or you personalize it, right? So you talk about them in the scenario of the education that you've just given them. Third step, which is the key bit here, is the rationalize. Okay, so you rationalize it for them. This is where you give them the expectations. So here's the injury. Here's why it likely happened to you and why your body responded the way it did. And the rationalization is, okay, here's the point. I believe you've got a grade 2 ATFL sprain, and you're about 3 weeks in. So we're looking at this period of time for recovery, most likely. And this is why you're getting these symptoms at certain times. You rationalize it and you give them their scenario inside that problem. The truth. Then the last bit is the clarification. And the clarification is where you then ask them if they have any questions. Do you have any questions about what I've explained? Do you have any questions about what we're expecting to happen over the course of natural healing? Do you have any questions about what else you can do, what else I can do? And then you sort of push that out for them and go, okay, here's what we're going to do. This is what it's going to look like. Now, what else would you like to know? What else can I tell you? And if we do all of those things and then go, right, now let's do our treatment, they jump on the table, they start the exercises with a full picture. They understand what it is that's happened to them. They understand why it's happened to them specifically. They understand where they are in the natural course of history and where they're going to go to. And they've been given an opportunity to ask any more questions and clarify any further. They feel like they're part of this treatment now. They are part of, they're a key component of it. I think, what do you think? Those 4 steps set you up then for a more productive treatment and rehabilitation program.
Yeah, that's great. It gives them the confidence in understanding it. That level of education can really decrease their anxiety because, think about that from an athlete point of view. What's going through their mind when they injure their ankle is, oh my God, I'm not going to be able to play. This is going to impact my chance of making that rep team or playing in the finals. They're really worried. They're potentially worried about some serious damage. Am I going to be stuck with this? Am I going to have horrible ankle pain? All of this sort of stuff is these subconscious thoughts that go on, and conscious thoughts that can really be quite detrimental. But by giving them that level of education, that can start to calm them down. But then they've got a plan. They've got a plan to work with, and that can give them some confidence in moving forward. And I think that is really powerful. So like anyone, like if we've got a plan, whereas if you say, oh, just see how you're feeling in the next week, let me know. And they're going to sort of walk away from that thinking, well, shit, like what do I do now? Like,
What do I expect to feel? What's good, what's
yeah.
bad? Yeah.
Am I like, how long is this going to take? Am I going to get better? See how I feel. Like, I mean, it's still sore. Whereas if you say, look, this is the plan. It's going forward. I'd like to see you again in 4 days. We're going to follow up, and this is ideally what we're going to go through, and we're going to see if we can progress those exercises. So I'd like to see you, 3 or 4 times within the next 2 to 3 weeks. Okay. And that way we've got some sessions in place, and then we're going to start to increase your capacity to be able to withstand load. We want to get you back running as soon as possible. Then we've got to get you to start to change direction and start to make it more specific to your sport. At the same time, we're going to be bringing up some strength work. So laying out that whole plan of what you're expecting and how you expect things to progress and move forward. Some variables that can be thrown in there, some things that can influence that. But getting them on board with that way they sort of, okay, great. I know what to work for. I know what I should be expecting within 4 weeks. And hopefully, in 4 to 8 weeks, then we can again move forward, and I can be back out playing with the team in 8 weeks. So I'm, hopefully can make it in time for finals or whatever it may be. That gives confidence and surety in knowing what they're going to do and how this is all going to roll out.
Yeah, that's right. And I think just to sum it up, I think it's like jumping in a car with someone to go for a long drive, and they say, where are we going? I don't know, we'll just start driving and see where we end up. And the passenger's sitting there going, oh my God, I am just going to be taken for a ride here. I don't know how long. Should I have packed a lunch? Do we have enough fuel? Am I wearing the right clothes? I don't know what to do here. So if you're going to take someone along for a ride, tell them where you're going. Tell them how long it's going to take. Tell them what to expect along the way. And then ask them, do you want to come? Do you want to be a part of this? Like, this is all we're doing. We're setting the expectations and giving them an opportunity to say, yes, this sounds like a good idea, or no, it doesn't. And if you're not the right person for them, that's okay. That's all right. You can maybe refer them on. And that's why we have referral networks, right? We can't solve everybody's problems. But don't let them get in the car having no clue where you're going and how long it's going to take. Give them some expectations.
Love that analogy.
All right. All right, let's wrap it up there, Bo. Thank you for that. That was a great one. Hopefully everyone listening and watching can take away just 1 or 2 bits from that they can implement clinically straight away. There's this idea of setting and explaining and extrapolating expectations for a patient, I think, is something super valuable. So thanks for your thoughts.
Thank you.
All right. Talk to you soon. Thanks, guys.